everybody! Today we'll be going over the deep muscles of the back. So we can kick us off and get started here. To get to these deep muscles, we have to hide some of these bigger superficial muscles. So we'll go ahead and hide the trapezius. We can hide the latissimus dorsi. And I'm going to hide some other ones here for simplicity purposes. We'll hide the rhomboids, since we already went over those, and the levator scap. Okay, so we can access the deep muscles. We'll be working on the left side of the body here. So, as you can see, we have a couple muscles here. Our first one on the list is the serratus posterior inferior, right here. This is a very thin muscle on the cadavers. It's very thin, as its whole job is an accessory breathing muscle. And our inferior, our serratus posterior inferior, actually attaches on that spinous process of that mid-thoracic spine, and then coming over to attach to ribs 9 through 12 to help with depression of the ribs during expiration. So we can go ahead and hide this one. Our next one is its brother, is the serratus posterior superior up here, attaching from the spinous process. And notice its downward angulation to attach on ribs 2 through 5. That helps with pulling the ribs up when it contracts to help elevate ribs 2 through 5 during inspiration. And a lot of these muscles, we talk about the innervation of them, I'll put the innervation up there, are innervated by the dorsal rami of that spinal nerve. So when the spinal nerve comes out of its intervertebral foramen at each level of our spine, it splits into two parts, the dorsal and the ventral. Ventral meaning front, dorsal meaning back. So a lot of these back muscles are innervated by the dorsal rami of the cervical or thoracic spine. So we can go ahead and hide this one. I'm also going to hide the spleniuses. We'll go over this in the deep neck muscle video here, and also the semispinalis one. Those are more so neck muscles, so we'll go over those in another video. So moving on, we can see three giant strap muscles here, and this is called the erector spinae. The erector spinae is consisted of three muscles. So the mnemonic helpful memory tactic that I like to use is I love spaghetti, standing for iliocostalis, longissimus, and spinalis. So we'll start with our iliocostalis. Notice how long and huge this muscle is. It is very long, and it stretches the entire length of your whole spine, cervical, thoracic, and lumbar. In fact, this muscle is divided. It's not depicted in the program, but this muscle is divided into the iliocostalis cervicis, thoracis, and lumborum, appropriately named based on what level it's from. Main thing here is that it is also innervated by the dorsal rami, and it helps with extension. So the erector spinae group, these big strap muscles, are really big for taking on the big load of bending forward of our whole trunk weight and everything like that. So here's our iliocostalis. We can hide this one. And then we move on, we come in, so that was our I, and then L for love, here's our longissimus. And so longissimus is also split up into sections. Is split up into the longissimus thoracis, longissimus cervicis, and longissimus capitis. And we'll go over these two smaller ones a little bit later. So here's our thoracis. Notice how it comes all the way down to the sacrum, coming all the way up the lumbar spine, thoracic spine, coming up to the cervical spine. So again, helping to extend the back and the entire spine, and also take on and support the load of bending forward. Moving on, we have the spinalis. So here's our spinalis thoracis. And the spinalis muscle, it also has multiple segments. So there's the spinalis thoracis, spinalis cervicis, and spinalis capitis. And we'll go over one of those later here, as it is depicted in the program here. And so here's our spinalis thoracis, appropriately named as it does stretch the majority of the thoracic spine, and is the closest to the spine as far as location-wise, most medial. And again, focusing on stabilizing that spine and help with extension. So moving on, we can actually go in and zoom in here to the upper thoracic and cervical spine here. So our next muscle on the list is right here. So here's our longissimus capitis. Longissimus capitis, capitis meaning head. So that's Latin for head, cranium, also capitis. And so this muscle originates starting down here on the transverse processes of T5 to C4. And so you can see here, we can actually see this on T4 here. We can see it coming up here and then traveling all the way up, and then it attaches up here at the mastoid process of the temporal bone right there. And so when this muscle contracts, it helps with extending the neck, extending the cervical spine, and then laterally flexing the head as well. So we can go ahead and hide the longissimus capitis there. The next small muscle that I want to talk about is this guy right here, our longissimus cervicis. And so cervicis, also cervical, Latin for neck. So it attaches to the neck. And so it starts down here. Again, same-ish spot, but the longissimus cervicis originating on that transverse process of T1 to T5. So it is a long muscle again. And then inserting on the transverse processes of all the way up from C6 all the way to C2. And we can actually see C2 in here, and we can visualize, that's C3, we can visualize our C2, also known as the axis. And right there is our transverse process, and you can see this muscle, our longissimus cervicis, traveling all the way up here, and there's that tendon right here inserting into the transverse process right there. Also responsible for helping to extend the neck and laterally flex the neck. So we can go ahead and hide our longissimus cervicis. The next small muscle is again relegated to the neck, a very deep muscle. Here is our continuation, another port of our spinalis. So this is the spaghetti in the erector spinae. This is its smaller portion. And so this one, spinalis cervicis, originating down here on the spinous process, not the transverse because it is closer to the spine, of C6 to T2. And then also inserting all the way up from C4, all the way up, here's C4, and then all the way up to C2 again, but this time going on the spinous processes. So you can see how it goes on C4, C3, and then again inserting right there on the spinous process of C2. And this muscle is responsible for extension of the neck and stabilizing that upper cervical spine. We can go ahead and hide that one. Our next series of muscles in the deep back are segmental muscles. Our first one we're going to talk about are the multifidi. And our multifidi are located right here. Here's our multifidi. And you can see how they do start all the way down on the sacrum and the PSIS, and then they also travel up and they start becoming these segmental portions right here. We'll zoom in for simplicity purposes so we can kind of visualize what's going on here. And so the multifidi, let's just take this, here's our lumbar vertebrae. There's our transverse process, here's a spinous process for your reference. And so these muscles start on the transverse process right here, and then they actually go up to attach on a spinous process of a superior vertebrae, kind of like on an angulation type of fiber orientation. And these multifidi attach above it to stabilize each segment of the lumbar and thoracic spine as they do travel all the way up to the mid-thoracic spine right there. And so these muscles are highly underrated, and I really love these multifidi as they do provide that segmental stability so that, and a lot of people with low back pain, these muscles get inhibited, and there's also research that supports there are like fatty infiltrations that happen with these muscles as well to shut them off essentially and make them weaker. And so if these muscles do get weak and people don't activate these as much, it creates a lot more demand on the giant erector spinae that we talked about earlier, which can cause a lot of muscular fatigue eventually, and destabilization of the spine, which could be a cause of low back pain. And so in physical therapy, we do try to get these muscles to activate with motor control exercises, which is really cool. But I love these multifidi. They're highly underrated. Love these guys. Segmental stability for the win. Okay, moving on, we can hide our multifidi. And moving up, we have some fun muscles. These are called the rotatores. And you can see how they go all the way from the sacrum, lower lumbar spine, and they go all the way up to your neck. And so we'll look at them in the mid-thoracic. It's a little easier to kind of see what's going on here. And these guys are rotatores, and these are very small, very, very deep. You can see how they're right on their vertebrae. And you have two types of rotatores. You have short rotatores, which is right here, and our long rotatores, which are right here. And so both of these start on a transverse process. Here's T11, just as a reference. Here's a transverse process. And they start on that transverse process, and then they attach to the lamina of a superior vertebrae. The lamina is a piece of bone, is that section of bone in between the transverse process and the spinous process. So that's our lamina. You can see how it attaches right there to the lamina. And the short rotatores go up one segment. Here's our long rotatores going up two segments. And again, these are very similar to the multifidi, not as big, but they help with segmental stability. They are named rotatores, so they do rotation. They do contralateral rotation of each vertebrae, and then they help with some extension as well. So we can go ahead and hide the rotatores muscles. And our last muscle that I would like to talk about today is deep in here. We are going to have to hide the external oblique and the internal oblique and the transverse abdominis. We'll go over that later in another video. It's right here. So here's our quadratus lumborum. So quadratus lumborum starts on the iliac crest, which is located right here, and the iliolumbar ligament right here, attaching the lumbar spine to the ilium bone, and then goes up to attach to the 12th rib. And this muscle is responsible for lateral flexion of the entire trunk, so it helps you lean to the side, and then also helping to extend the trunk and the actual lower lumbar spine as well, and then also stabilizes that 12th rib during breathing and making sure that it's moving properly. Innervation of this guy is a little different. All the rest of the muscles were innervated by dorsal rami. This one's innervated by ventral rami, so the front part of that spinal nerve, and it's innervated all the way from T12 all the way to L4. And those are all of the deep muscles of the back that I wanted to talk to you about today. If you have any questions, please feel free to leave them down in the comments. I hope you learned something. I hope this helps. I'm the PT guy, educating you on God's wonderful creations. I'll see you in the next one.